So we're just going to talk about emergency scene management. So it is the management of an unplanned situation that calls for immediate action using a sequence of steps designed to lessen the impact of the emergency and to ensure appropriate aid is provided. So what would you say emergency scene management means to you in other words? Anybody?
Doing what's necessary in that time and place to make sure things are safe and run smoothly. Take care of the problem.
Right. Okay. And then getting them to the hospital or like phoning the appropriate 911 as needed, sort of thing. Yeah. Anybody else?
And just like keeping your own safety in mind too, like assessing the scene and making sure you're not putting yourself at risk and sort of compounding the issue.
Mm-hmm. Anybody else? Okay. Okay. So, emergency scene management is comprised of, the scene survey, the primary survey, secondary survey, and ongoing patient care. So it's really important that we kind of follow this in any kind of first aid that we're going to do in this, that we're going to practice in this course, is that we kind of do that. So we always follow scene survey, so we're always looking at the scene first, then we're always going to do the primary survey, then the secondary survey, and then continue with patient care, because that's kind of like what's recommended to be the best thing to do. So we'll do that throughout the whole course. And again, like scene survey, so you're not going to want to walk into a dangerous situation. So if we look at the scene and it's dangerous, we're just not going to go in. We're going to phone 911, and we're not going to put ourselves in harm's way. So, okay. So the definition of medical help: care given by a physician or by someone working under a supervision of a physician, so the paramedic. Signs and symptoms: you can see signs, the patient can feel a symptom. Okay, so we're on the scene, and somebody comes up and they say, "I'm a doctor." Okay, so then do we just allow them to go? Oh, okay, you're a doctor. Anybody?
You want to work with them. So. Okay. What type of doctor are you?
Right.
What are you comfortable in doing in this situation?
Because what if they're a veterinarian?
Yeah.
So kind of finding out a little bit, like, yeah, exactly what Lauren said.
Yeah.
Or a dentist.
Psychiatrist.
Yeah, exactly. So finding out a little bit. So for the scene survey, so it's going to be a careful, quick assessment of the scene to see hazards and identify what happened. So that's going to be key in our spinal injuries, pelvic injuries, things like that. Kind of seeing if you can tell what has happened to the person so that we can properly provide first aid. So also part of that is we're going to put our PPE on, so like whatever we see fit, gloves, mask, whatever we have on hand that's going to be useful in that situation and protecting yourself. And then looking at the patient, are they in danger themselves? Can you move them to, if you don't suspect a spinal or pelvic injury, can you move them to a place that's not dangerous to then provide them with some minor care sort of thing? So our primary concern is personal safety for ourselves. When you walk into the scene, consider what you see, hear, and smell. So think about all those things before you enter. What do you think happened? So that's what we talked about before, the mechanism of injury. Okay, so assess the scene and take charge of the situation. So that'll be important, especially if there's like a few people like mingling around and don't know what to do. And so we're going to go in there. We're the first aider. Take charge. Identify help or need for help. So is there a medical doctor within there that's willing to help you, within those people that's around as well? Do you need to phone 911 before you do anything? Do you need to send someone to do that? Do you need to do it yourself? Kind of assessing the situation before we even start anything. And then again, the mechanism of injury. Then after that's all done, approach the patient and identify yourself and get consent. So again, like we talked about before, the consent implied if they're unconscious, and if not, we need to get consent verbally. So, this is kind of just what we just talked about there. Okay, so what would you say, so looking at all these different key points, what are hazards for each one? So we'll start with home. What could be a hazard in the home?
Kitchen knives.
Yeah.
And the animal.
Yeah.
Fire, carbon monoxide.
Okay, what about workplace?
Maybe chemicals, depending on the workplace. Maybe some dangerous chemicals.
Carbon monoxide.
Yeah.
Fire.
Lifting, like heavy objects falling.
Okay, and then we'll just do motor vehicle accidents. What do you think?
Gas, explosions.
Yeah.
Fire, carbon monoxide.
Yeah.
Other vehicles coming to the,
Yeah,
to the scene.
Other vehicles, yeah.
Could be like a hydro line down or something, so you're dealing with that.
Okay, so we'll get into partners, and we're gonna practice performing a scene survey. So, I don't know, Tanya, do you want to be a
Sure, I
partner?
can be a
Okay,
partner.
so then we'll everybody partner up, and then, then I'll give you a situation. Hang on. Okay, I'll leave the steps up. Okay, so you guys all have partners. You're good to go.
Who's my partner?
Misty.
Misty's my partner.
Okay. So we'll go through steps 1 to 4, like you can see on the PowerPoint, with the situation. Okay, so you walk into your mom's house, and you left your daughter there with her to babysit. There's some like bleach on the floor. The daughter is on the floor as well. She's unconscious. Your mom is yelling, screaming, doesn't know what to do. You walk in. Okay, what do you do?
So, do you want us now to just?
Yeah, so talk amongst your partners, and then we'll. Okay.
And I'm probably take them outside.
Yeah, to get the names and the things. I didn't need to identify myself because it's my mom.
Don't have to get consent because
No,
it's
I'm
okay.
not.
For us, give them my card.
Yeah, I've got and you bring them upstairs to do that. Yeah. So ask the circumstances and then I guess go to perform whatever needs to travel.
Yeah.
Is my child unconscious? Did you say that the child is unconscious?
Yeah.
She breathing.
I don't know.
That's part of our
Yeah. Okay, everybody kind of have an answer?
Yeah.
Okay, so let's start off with step 1. So assess the scene and take charge of the situation. How will you do that?
We're gonna do a scene survey
Okay.
and look around. So we see bleach on the floor. How much bleach? Where is the bleach? How close to the baby is the bleach? The mom's freaking out. So we want to take charge and
assuming it's safe for us to go in.
yeah.
911.
So that's okay. Yep. Call for help. Okay.
And kind of give the mom like that job. If she's kind of freaking out, you can say, okay, we need to do something about this, we need to help, so if you go call 911, I'm going to figure out what's going on here.
Yeah. Good idea. Okay, and then we've identified what's happened and the mechanism of injury. Right, we kind of suspect that it's bleach because of...
But we can also ask